Hey guys, what's up? It's Paige. So another post-op update. I'm 7 months now, and real quick apology for not posting a 6-month update video. I was out of town that week, and I had an intention of making a video when I got back, and before you knew it, 6 months had turned to 6.5, and then now we're here at 7. So I figured I'd just start clean with this month and just keep going forward. I'm also wearing a hat because my hair is kind of a mess, so hopefully you can see my face okay and it doesn't get in the way of me talking. I don't know. So anyway, my chest, let's do a close-up per usual. Everything still looks really good, very thin, a little bit of irritation here still, so again, that's not stretching of the scar. They're kind of purple pinkish all the way around. The nipples are still very pink in color, a little bit of pigment returning there. This one, a lot more pigment has come in. You can see around the edges and in the middle. So all in all, I'm still really happy with everything. My whole attitude towards my chest, and I'm not actually sure if I've said this in other videos, but my whole attitude, start to finish, of having surgery all the way up until 1 year post-op was that I don't want to have any regrets. So whether that's picking a surgeon, having my surgery, coming out and saying, oh man, I wish I would have gone to so-and-so. So by picking Dr. Garramone, in my opinion, was the best surgeon. My whole thought process going in was that even if I come out and something doesn't look how I would like it, I went to what I consider to be the best surgeon, and these are like the best possible results I could ever achieve. My recovery I've treated the exact same way, so I don't want to do anything that I would regret. For example, I don't want to go and have my chest exposed to the sun and have permanently reddened scars and, think to myself, damn, I wish I hadn't have done that because then my chest wouldn't have looked like this. Or I don't want to reach overhead or do, like shoulder press or pull-ups or anything like that where my scars are going to stretch and again have regrets that I didn't take better care. So it's been mentally challenging having that kind of constantly on your mind that you still, 7 months post-op all the way up until a year is where I'm, kind of leading this recovery into, of really just restricting myself from doing certain things, whether it's working out in a certain way, not being in the sun, continuing to wear the scar strips, continuing to do the massage, things like that. So recovery for me is a full year commitment. It's not just 6 weeks, it's not a couple months, it's a full year. And it is challenging, but I think it's worth it. It's a very small investment given the amount of money you spent on your chest, given, the amount of time that went into planning what surgeon you're going to go to, making all the accommodations. It's kind of the least you can do to yourself, like just basic self-care of taking really good care of your chest so that after this 1 year, when everything's kind of settled, you're just gonna have like the most amazing results that you could ever have. So that's my whole approach. With that being said, my scar care regime is really unchanged since all my other videos. I'm still doing the strips. These are the Mepiform. They're slightly thinner. I'm also using the here. The Scarway strips are a little bit thicker actually, side by side. You can see they're a little bit different, so I'm kind of just switching between the two. I do have a preference for Scarway because they're a bit thicker, but I don't really think it matters which ones you use. It's just personal preference. The other thing I'm using very occasionally is just some like moisturizing sunscreen. So it's Neutrogena oil-free moisturizer, and it has SPF 35 in it, so that's really good. For whatever reason, if I'm not wearing the strips, I still have protection from the sun, my scars are still hydrated from the lotion, and they're just, being well taken care of. The only really time I've used that is like right now, for example, for this video. I'm going to the gym in a few hours with a friend, so I'm not going to have a chance to wear the strips for the full, 12 to 16 hours you're supposed to, so just having the sunscreen is somewhat of a barrier, and it just keeps my scars nice and hydrated. The only other thing I want to talk about, which I hope I don't get any negative comments on this, but you know, that's not fully within my control, is that anytime, and I 100% include myself in this, anytime people take advice off of YouTube or off of, you know, an individual who's not in the medical field, who doesn't have any real credibility to be talking about things, I don't think you should take it point blank for truth. So what I'm talking about is, like, I, for example, claim that these scar strips, like the Mepiform and the Scaraway, are the best form of scar care. That is 100% my opinion, that I don't think there's anything better out there you could be using than silicone scar strips. With a caveat being that there is one product called Embrace. I've never used it. It's really expensive. It's another type of like scar tape. I think it's clear, and it costs maybe like $100 per week or per 2 weeks. It's really, really expensive, and that's supposed to be, I think, like the gold standard to prevent widening of the scar. I don't think there's any other product on the market that can say that it prevents against scar stretching. But anyway, all I'm saying is that these are, you know, the opinions that I've formed based off research that I've done. And a lot of the times what you'll see is that someone will make a video, they'll start preaching about one scar treatment or another, and the comments are saying, oh, that's really good, your scars are great, I'm going to use that. And it sounds like people aren't going and doing their own research to validate what the person is saying. And I think that's really naive. Like, we're in a day and age where information is so accessible. You can go online, you can read blogs where medical professionals weigh in. Realself.com is a really good source of information where people ask questions, and a lot of different surgeons and doctors will respond in the comments saying, you know, their opinion. And that's the type of information you want to be listening to. YouTube, I would say, is a starting point. It's a really good starting point. Like, I'm talking about these scar strips. I would hope that anyone actually interested in using scar strips go and does their own research and then feels comfortable enough to start using them on their body. Because at the end of the day, like, you're accountable for the results of your recovery. Like, yes, your surgeon plays a big role in what your chest is going to look like, but as far as how your scars heal, how your nipples heal, how your scars do or do not stretch is on you. And if you're just listening to someone on YouTube because like they said this is a good method and it doesn't work for you, you know, like, you should have probably done your research ahead of time. So I think another really big thing is that everyone's bodies heal a little bit differently. Like, genetics play a huge role in scars. I know people who are, I don't know the best way to say this, like, people who aren't white tend to have more keloid scarring. That's just a genetic thing. And hypertrophic scarring might be in your genetics, or keloid might be in your genetics. And if you're going and listening to advice from someone that said, you know, I got really good results from Mederma, it may have nothing to do with Mederma. It might just have to do that they have really good genetics, or that they stayed out of the sun a lot, or that they prevented overhead or, you know, the direct tension on the scar. So do your research really thoroughly before you go and, you know, take advice from someone who doesn't have credibility. And again, I'm including myself in this. I'm not saying that I have credibility. I'm not a medical professional. That's not what I studied. This is just from research that I've done, and I would hope that you can go and do your own research and find the same information. Or, you know, if you find something better, please do that. Let me know. Let other people know. Spread the information. So that's all I have to say. Just to recap, I am committing a full year to recovery. So that's a full year of scar treatment, a full year of limited mobility, a full year of either sunscreen or not any exposure to the sun. It's mentally tasking, but I really think it's worth it. So that's all I have to say. If you guys have any questions, comments, whatever, let me know. If you think this video might be useful to someone, you can share it by all means. I've never been one of those people to be like, comment, subscribe. So, you know, do whatever you want to do. Don't feel obligated to subscribe or whatever. Just hopefully this is helping people out there. That's it. So I'll see you next month. I might be posting more content in between just to, I don't know, spread more information about things. So TBD on that. But if you guys have suggestions on things you want to hear me talk about, I can for sure make those videos. Again, I'm just trying to help other people and document my own gender journey. So that's it. See ya.